Obesity tends to be associated with type 2 diabetes. Why may obesity cause type 2 diabetes?
Patients with obesity tend to have high glucose levels in their blood. When excess glucose is available inside cells, it is initially converted into glycogen. When glycogen stores are full in cells, glucose is converted into triglyceride through a process called lipogenesis in liver hepatocytes, muscle cells, and adipocytes. The accumulation of triglyceride in adipose tissue contributes to abdominal obesity due to the generation of subcutaneous fat and visceral fat. The abdominal fat is the source of continuous triglyceride release to the bloodstream, and these triglycerides are converted into diglyceride by lipoprotein lipase located on the surface of liver hepatocytes and muscle cells. The diacylglycerol activates PKC that phosphorylates and inactivates insulin receptors, which causes insulin resistance.
I understand the mechanism of insulin resistance due to abdominal fat. How can we prevent obesity?
Avoiding overeating is key to achieving the goal. If patients feel difficulty in stopping overeating, it is time to check the balance of two major hormones. The hunger hormone, ghrelin, stimulates appetite. The satiety hormone, leptin, suppresses appetite. Typically, stress causes overeating in women. Overeating may disrupt the balance between ghrelin and leptin. When leptin level is low, leptin deficiency, patients may not be able to feel full and tend to eat more foods, which leads to the body being in a state of malignant circulation. Food addictions, including carbohydrate addiction, are also related to a hormone called dopamine.
I understand that the hormone balance is helpful for patients with obesity to avoid overeating. Then, how can we obtain hormone balance if the balance was already broken?
Visiting doctors would be recommended to diagnose the obesity case and discuss various causes, including hormone imbalance.
Are there any ways we can do this before or while visiting doctors?
There are multiple ways you can try, which include a low-calorie diet, a low-carbohydrate diet, and intermittent fasting with skipping dinners. Intermittent fasting with skipping dinners may give patients with diabetes better sleep quality, and an opportunity to heal their digesting organs due to fasting time. Another important benefit is losing weight, which is linked with reducing visceral fat and decreasing blood sugar levels.
That's good. Reducing visceral fat is a desirable benefit. Why does skipping dinners reduce visceral fat?
Skipping dinners may generate a shortage of carbohydrates that are the source of glucose. Low glucose level triggers pancreas alpha cells to secrete a hormone of glucagon. Glucagon makes the liver convert stored glucose, glycogen, into glucose that is released into the bloodstream. When glycogen is not available anymore, visceral fat begins to be converted into ketones, which are alternative fuels for the body. This is also related to a ketogenic diet.
Are there any cautions for skipping dinners?
Skipping dinners is generally good for patients with diabetes. However, they need to be careful about hypoglycemic shock, also known as diabetic shock, which occurs when their blood sugar levels drop extremely low.
Are there other benefits of intermittent fasting?
Autophagy may be activated after about 16 hours of fasting, although the activation time might depend on the patient's metabolic situation. During autophagy, cells remove damaged cell components and recycle them to generate energy.
How about one meal a day diet?
This is a type of intermittent fasting, which has a longer fasting time. Maintaining one meal a day for a long time is not generally easy to do. Although the amount of one meal would be limited, the number of calories needs to be controlled by avoiding refined carbohydrates. The excess number of calories can be taken by eating refined carbohydrates such as wheat-based foods, rice cakes, sodas, and snacks.
I agree that there is no point to eat one meal a day if one meal has an excess number of calories. What if a patient cannot help eating refined carbohydrates for one meal?
If patients with obesity cannot help eating refined carbohydrates, it would be recommended to choose other types of diets, for example, skipping dinners, a 2 meals a day diet, and a low-carbohydrate diet.
Would you remind me why the low-carbohydrate diet is helpful for obesity?
The low-carbohydrate diet triggers pancreas alpha cells to secrete a hormone of glucagon. Glucagon makes the liver convert glycogen into glucose, called gluconeogenesis, and the synthesized glucose is released into the bloodstream. When glycogen is not available anymore, visceral fat begins to be converted into ketone bodies, which are alternative fuels for the body. Ketosis, a metabolic state of high ketone bodies in the blood or urine, can be induced by a low-carbohydrate diet.
Aha, it is also a ketogenic diet. Thank you for the helpful information. If this video is also helpful for viewers, I would like to ask them to subscribe here and watch other related videos. Thank you again. See you soon.